So welcome everyone to today's webinar on art and health practice. Just like to acknowledge that we're gathered on Gadigal land here today and acknowledge the lands that you're coming to from today as well. I do encourage people to put in the chat where they're joining from. And yes, I'd like to introduce our speakers here today. I'm joined here by Bridget Uren, Program Director of Arts Health Infrastructure. Joined on screen here by Tim Braham, Regional Gallery Director, Central Coast Council. Michael D'Agostino, Director, Museums and Cultural Engagement, Church Ring Museum and Seymour Centre. And Amanda Solomon from, I don't have her title here. Amanda will introduce herself. And I'm Brett Addington, CEO of Museums and Galleries of New South Wales. There's a Q&A function on screen if you put questions into the chat, particularly related to the Arts and Health Award, if you've got questions around that, and we can answer those as well. I guess just to provide a bit of context for today, we're here to sort of talk about arts and health practice with some people who've been sort of leading in this space, and also sort of talk about the Arts and Health Award that is coming up and open now. Just a bit of context, I guess, for the organisations that we both represent. Museums and Galleries New South Wales is a peak body and service organisation for museums and galleries across the state. And Bridget's joining us from Health Infrastructure. You can talk to, I guess, the role that health infrastructure plays in the sort of arts and health space as well.
Yeah, well, thank you very much, Brett, for having health in the room and in the tent with you. We are very proud to be partners with a number of our local health district and specialty health networks across the state. And I believe a number of my colleagues are online today. Welcome very warmly to you. We may also be joined by Auntie Joyce Saunders from Southwest Sydney Local Health District today, and she may certainly be online already. One of the roles that we play is to enable South Wales Health and the Arts Framework, and then in addition to that, then support the aspirations or the existing programs that may be already happening across a number of hospitals or healthcare facilities across New South Wales. So we're in, large metro as well as small rural and remote communities as well. Everything from paediatric care right through to aged care.
So I guess just to start, can you just tell us sort of why is New South Wales Health interested in working with the cultural sector on art and health projects?
We're very interested in working with them for a number of reasons, and it depends the service that is engaged with it. But as a whole, across New South Wales Health portfolio level, we're really interested in it because of the role of arts in supporting improved healthcare outcomes and how artists can stimulate and create an environment that's far more appealing for people to be seeking healthier outcomes.
Yeah, right. Can you point to some of the health benefits seen from creative activity in clinical settings?
Yeah, range of them. So you'll hear from Amanda later today what that experience is like at RPA. Certainly in a number of health services that we're engaged with. For the most part, and the role that health infrastructure plays in this, it is around how we can support reduced length of stay in hospitals, or also increase the time between readmission. That's particularly important in mental health. It might also be the case for renal wards or oncology wards, that those frequent visit experiences are improved from being able to experience artworks, music, participatory arts experiences.
Can you just tell us about what relationships and collaborations look like across the sectors, across the sort of arts and health sectors? How does that sort of look like in your sort of world?
Well, very dynamic and very exciting and very multidisciplinary. We're going to hear from a range of those collaborators and partners today. And certainly if anyone is interested in having more detailed conversation, we would love to have that. Right. The partnerships are very, very rare, varied. That might be from looking at hospital campuses, like a whole of health experience. It could be, for example, trying to improve the relationships between Aboriginal community and that arrival experience to that health service to create a more culturally safe experience on arrival. It could be very targeted to emergency care, for example, or even to a paediatric ward. In remote rural New South Wales, we've been working very closely with the Murrumbidgee Local Health District and created a program based off the Archive of New South Wales Dementia Program in residential aged care services. So that experience there might be very different to what Amanda will share with you today from RPA or Michael in his experience at Campbelltown Hospital. So the partnerships can be very varied. I think where they work well is where there's mutual benefit. So the gallery, the museum or keeping place, they might be already engaged in particular activities, and equally at the health end, seeking to provide more engaging, more meaningful programs for their consumers, that when we come together and those experiences of participatory arts experiences really do have a massive impact on clinical care outcomes.
Yeah, right. Amazing. We might sort of pass across to the speakers today. I guess you're going to sort of ask some questions to our speakers. I'll pass across to you, Bridget.
Yeah, thank you. Have we got a speaker issue you can't hear? I need to get closer to the mic.
No, I'll change your one back on.
Okay, all good. Yeah.
Thank you. We are delighted to have Michael D'Agostino, as Brett earlier offered before. We will then hear from Amanda at RPA and then finish with Tim from Gosford. Each of them have had really exciting, diverse and multi-purpose projects in those collaborations with health units, hospitals and services more broadly. I'll go to you first, Michael. How did the partnership start between Campbelltown Arts Centre and the South West Sydney Local Health District?
So the partnership was built on, I guess, relationships. So we had at Campbelltown, and everything's going to be spoken as in the past, I guess, because I'm no longer with the Arts Centre. Okay, so we had the Campbelltown Arts Centre Strategic Committee, and on that committee we had a range of different stakeholders, and one was the General Manager of the Campbelltown Hospital. She was a fantastic and dynamic person that really understood the impact that arts could have on the redevelopment. So when the redevelopment started, she approached us with this idea of not creating public art, but seeing how we could integrate art within the fabric of the building. Some of the things, she would send me articles, like there was a prescription where people from a hospital in Norway, patients, were taken to galleries. There's a hospital that has a Brian Eno soundtrack. So she was finding all these different resources and sending them to me. So we were able, through that relationship, to have a meaningful impact in the development of the Campbelltown Hospital. So how did it work? We were able to work directly with the architects and co-design. There was a number of different patient user groups where we could co-design artworks that were basically integrated into the fabric of the hospital, as opposed to public art just being plonked into the foyer or into various spaces across the hospital. And so the ways that we did this was through, we set up a consultation piece. We met with some of the patient user groups and the staff user groups, and we asked them a series of questions. We asked them what were the issues that they were facing with the hospital, the redevelopment, and what issues would they be facing after. And in doing so, we came up with two kind of propositions that we posed to artists. What should a hospital feel like? And how can we make First Nations people feel welcome in the hospital? Because at the end of the day, the feedback that we're getting through this co-design process was that hospitals are terrible places. they, they're not built for patients. They're very efficient places. Also, a lot of First Nations people didn't feel comfortable going to hospitals for a whole variety of different reasons. So how could we kind of affect that? And lastly, because people have different states, either grief or high elation when they're inside the hospitals, there might be a birth or a death. How do you create spaces that are sympathetic to both of those than just being generic spaces? So that's how we came up with the two, what a hospital should feel like, and how can we make First Nations people feel welcome within the hospital. And then we engaged two artists, Erica Seacombe and Nicole Monks, and they kept working with the communities within the hospital, the patients, the staff, the architects, and then finally builders to develop these projects, which were delivered. No.
And she may be able to contribute to this conversation. I'm really interested, Michael, in that very point, how we bring First Nations voices into these experiences, given the huge role that arts and artists can play in reshaping the experience of healthcare for Aboriginal communities.
So there was a strong Aboriginal presence within the hospital from a staffing perspective. There's also Thurrowa Medical Centre, which wasn't a part of the hospital, where a lot of Aboriginal people would go to. So what Nicole did was meet with a lot of people, a lot of patients, didn't go with any preconceived ideas about what should happen, met with the elders and started forming up the works in consultation with the local communities. She was like, I'm not here to create work, I'm here to listen to people and develop the spaces that they want to be in, rather than imposing, than her ideas into these spaces. So she worked really collaboratively with all of the elders, patients, and one of the great outcomes that I heard about was one person had stopped going there. She didn't feel welcome there. She didn't feel comfortable going to Campbelltown Hospital. But because she was included in one of the workshops that Nicole was facilitating, she actually started going there weekly to get checkups and to kind of rebuild her health, which was a really fantastic outcome for somebody that was completely disenfranchised with the health system, to bring people back in. And that's where arts can play an integral role in not just managing the effects of a disease, but actually preempting and being at the forefront of healthcare and preventing disease.
I think that's a really great point, and the role of artists in that way in creating an environment to facilitate arts projects, not necessarily being the hero of the art project at the end of it. That's something that I've learned quite a great deal about from Amanda Solomon, who joins us from RPA. You can see she's wearing an orange apron, which is really deliberate. Amanda, do you just quickly want to introduce your role at RPA and the impact of the orange?
So I founded Artery about 10 years ago. We brought a pilot to Chris O'Brien Lifehouse, and we ran that for 6 months. I got some research done during that, and at the end of that 6 months, it was very well received, and we were basically taken on. And since then, I was then asked to take the program to RPA, and so we've been in operation for 10 years, and we work across. I've got a team at RPA and a team at Lifehouse. And ostensibly, we use the arts to enhance the healthcare environment and the experience. And, our programs are designed to be, I know you're talking about health teams, Bridget, before you're asking. Our programs are really designed to be inclusive of the entire hospital community. So it's, yes, working with the health, the health and the clinical teams, but it's also the executive, the management, admin, patients, carers, staff, visitors, the retailers, the florists, every person literally that walks through that door. And the challenge is, how do you make an impact in a huge multi-level building that literally has hundreds of people, walking in every different direction. They're all stressed, and how do you physically reach them? How do you engage with them? What areas do you focus on? What patient groups do you prioritize? What can you offer them with their health limitations, and how do you reach busy staff is another huge challenge. So my approach was to basically infiltrate the building, and came up with 3 different programs for that reason, so we could find different people in different locations throughout the building. So we have our 3 core programs, and they're all delivered in public spaces. So we really focus on utilising public spaces, which gives us visibility, and it means that the people in the hospital can actually participate, but they can also observe. So it can kind of function as both types of engagement if people don't want to physically engage. If they do choose to participate, then we offer a choice of activities, and then once they go into that activity level, then there are again more levels of choice. So it's about providing them choices in their day when they're not normally having any choices, because they're being told what to do, where to go, what treatment they're having. So basically, we have a program called Carty, which is an art cart we take up to the wards. It's a one-to-one program, and we have pre-packaged art packs on those. And at the moment, we've got a movement series that covers the major art movements from prehistoric to contemporary. Then we also have a workshop program, so we work in groups of 20 plus, so that offers a more socially inclusive option if you want to engage that way. And then we also run an open community artists in residence program, so they're in the foyer. Again, all our programs, as I said, are delivered in really high public spaces, so they're really visible. Will I talk about the different projects I've done, Bridget?
Yeah, I'd love to hear them in the context of the partnerships that you've had in some of those experiences. What do you wish arts organisations knew about working in healthcare? Yep,
okay. So basically the approach, okay, I'll just give a few examples and just tell me if I've...
Right. Yeah, go for it.
So I'm currently working with Craig Barker at the Chachakwi Museum, working on a project with the movement series that I just mentioned, and they are very kindly going to be creating some sort of expert videos and connections to and access to their piece, selecting an artwork for each of the movements that we're talking about. So there'll be a direct link to that, and information and an expert talking about each of those movement series. So that's really going to enhance what we're doing, our core programs. And I think all the different projects that I've done with galleries and museums, it's all about enhancing our basic core programs and giving that expert advice and opinion on things. So that's been a really good thing. I also worked with Craig years ago when he was at the Nicholson Museum for a project we did called ArtMed, which was working with first, second and third year medical students and working on enhancing their observational skills. So we used the tactile projects there as a descriptive project. We did drawing classes and we did visual thinking projects. So that was very positive. And again, providing that access to their collection. I did a great project, which Bridget, I know you're involved with the Art Grove New South Wales and the RPA Memory and Cognition Clinic over 2 years, working with a group of dementia patients. And again, we had access to 10 artworks from the Australian collection, and each month we would have a workshop utilising one of those artworks, and then we created an art activity. We had a guest musician, we had a guest poet, and we had an art making activity. So we did a collection of those over the 10 months, and that was a really wonderful celebration. And we did have an event at the gallery to sort of showcase that, which was very positive. We have also worked with the MCA, who have provided workshops here at Lifehouse, and we've taken patients into the MCA, and we've also done artery professional development projects with them on site. And also I work with Scott, who runs the museum here at RPA. So it's really been great to have an on-site, museum, so we can access their works. And I've had artists in residence who do projects and exhibit up in that space. So yeah, they've all been really great partnerships and really just enhancing what we're already doing. And we reach, like, between the two hospitals, we're reaching over 10,000 patients per annum. So it's really great to be able to think that we can share if we, with them, for example, with the Movement Project, we can share that access and make it a broader, audience for the Chow Chak Wing Museum.
I think that's really great, listening to what Michael was saying, and when he was at Campbelltown, and also your experience with Sydney Uni as a partner. What's common to both of your experiences, in fact, from both sides of the fence, is the partnership that was built in really being neighbours, or your closest, gallery or hospital.
Yes.
So
absolutely.
some of the language we've got in that award submission process is around local health districts. Under each local health district, Brett, there's a number of different hospitals, health services, or like the Tharawal Medical Centre, for example, that Michael mentioned before, and how you can tap into those and draw out some of the unifying activities that each party is involved with, and celebrating, exactly as you said, Amanda, and elevating what's already been done or doing, and taking it to another level. And that might be to support, exactly as you said, like a dementia clinic, or it might be supporting workforce, or it might be supporting staff training specifically. So there's a range of different projects and partnership types that are available and opportunistic for galleries and museums, keeping places to get involved with. I think Joyce may be online now. Is that right? I'm seeing something trying to happen. And another great example of that is the Bowral Hospital working closely with Nunangula Gallery to deliver a range of language workshops for both community and for children at primary and senior schools. That was a really important project because of language and cultural identity being particularly important to Aboriginal and Torres Strait Islander communities. And we see that right across the spectrum of healthcare in New South Wales. If you're in a small rural area or a large metropolitan, almost all galleries and museums are actively involved in supporting Aboriginal programs. You'd be surprised, in fact, the values that your cultural services could bring to supporting those Aboriginal healthcare outcomes in your community. And the Aboriginal health services are generally the best go-to for those connection points. And certainly if you were looking as to where to start, the colleagues that I've got online and myself would be very eager to support those introductions if you would like them. I'll go to you, Tim, from Gosford. You've had experience not just with Aboriginal health, but more broadly, chronic care and outpatient clinics. How did your relationship with the Central Coast Local Health District start?
Thanks, Bridget. Our relationship actually started through the redevelopment of Gosford Hospital, and at the very early stages, the hospital was starting an arts strategy committee and approached me to be on that committee, which involved staff and patient user groups. And what quickly came out of that was that in the redevelopment of the hospital, obviously better primary healthcare was the key focus, but the staff and the users were very much vocal about it not just being a better facility with the medical equipment and that sort of stuff, but it was actually a more human experience. And that's really where the art strategy came on board, was actually looking at, well, how can we develop a human experience? And similar to what Michael said about Campbelltown, it wasn't about plonking public art in the new facility. In fact, there was no budget for public art, which was surprising for a lot of people, but was the way it worked out. So we focused our attention on, well, how do we create an ongoing relationship between art and the users of the hospital, being both patients and staff, and within the then discussions with the architects and stuff, we were able to formulate a plan to have a temporary exhibition space, which then became an ongoing programming space for the regional gallery to put exhibitions on as we would with any other exhibition space that we manage. And but obviously with a specific focus on health. So that's enabled us to do programs with a whole range of health users and with staff. So we did with the several First Nations focused projects, but one Mana Yada, which was, translates roughly to get well, with the chronic care patients being serviced through the Aboriginal Health Unit. And our focus was as much as possible to bring professional artists into the space to work with our community users and to get them to have that experience of working with an artist, but to do something that was relevant to them. So projects range from Mana Yada to projects with the Cancer Centre, and then one of our most recent projects, which was the one that was funded by the Arts and Health Award, which was Weaving for Wellbeing, which really took to a new level of being able to engage right across the hospital sector, and to work with patients and staff at the same time, and create a weaving-based exhibition within the hospital that really aimed to break down the barriers between staff and patients as well. So part of the setup was that we ran drop-in weaving workshops where patients would be on their ward, but the staff from that ward would then just come when they had 5 minutes, 10 minutes, half-hour lunch break, whatever they could do. They could come and actually do weaving with the patients. And that really just broke down a lot of barriers between patients and staff, and enabled staff to have human contact with their patients and to be able to, talk to them about things other than their healthcare, which they all found really beneficial.
We hear that a lot. In fact, Tim, it's a really great segue to a number of different conversations where it can go. I think the opportunity for arts to really support that relationship between carer and patient is exceptionally important. We've heard that from Amanda today in what that can do to bring people together. I'm delighted to have Auntie Joyce Saunders online today. Welcome, Joyce. We are just sharing the experiences across a range of different projects and partnerships. The recent example from Barrel Hospital with Nunangula and Red Room Poetry, what has that meant to you as a healthcare worker at Barrel Hospital to bring those communities together?
As the Aboriginal liaison working at Barrel Hospital and Bankstown Hospital, it's very important to include our communities in our projects across the hospital. It's about engaging patients and Aboriginal people who will actually come to the hospital, and it's designed to make patients, when they're attending our hospital, feel safe. At Barrel and Bankstown Hospital, we noticed that when we engage community in with hospital projects, it works. And just by having Aboriginal people work at the hospital also helps that engagement. So for us to connect with community, we connect across through different health services, chronic health, and then we refer it back to community. We do a lot of community involvement with attending local community meetings with non-Aboriginal and Aboriginal services, and networking that way. So we find that with the engagement of having Aboriginal people connecting with Aboriginal people, our communities and our mob are more likely to come to our hospital and feel welcome there.
Yeah, great. The co-design piece that you talk of there has been echoed with Michael and his experience working with Nicole at Campbelltown Hospital. Amanda referenced it also from RPA, so too did Tim just then. If I go back to you, Joyce, the co-design experience from working with Curly and Red Room Poetry at Nungula recently, what do you feel that has shifted or could shift in terms of healthcare at Barrel Hospital?
So along the way, Bridget and I have found that working with community and with children and with community elders works. It's connecting also to all the people that are in that dynamics. So across most communities of Aboriginal people, we find that there are different Aboriginal communities living together on the same area of where they come. So we've found by connecting different elders in that structure, it's helped to bring out different understandings, I guess, for us to work together with them to make it work properly. I feel that, you know, like it's one of our first biggest projects. Like, we do a lot of community things, but this is our first project that we've really worked with community for the hospital, and we want that to look like the redevelopment is connecting Aboriginal people back to the services and to feel safe within their environments. Yeah. We've spoken to length about different things that are happening there and the different dynamics of elders. I've lived on Gundungurra or Garungra land for 54 years, and through those dynamics I've found different communities coming together and keeping them alive and trying to work around with all of them is a total respect that we should have, even as Aboriginal people, working with each other and trying to get those people to come together, basically. Otherwise, you'll have some people coming to the hospital and other people not coming to your hospitals. And that's very important, that we include everybody.
Yeah, really great point. I'm sure we're keen to go to some questions. I'll just ask one offer a final statement and go around the room what your respective experiences were in this. From everybody I've heard today, and certainly it's my experience also, the opportunity to be open-ended with what the outcome could be and not have a fixed position on what it is or should be, I think is a really important part of developing an arts in health program. When you're bringing two industries together and the co-design piece that's necessary between artists or institutions and healthcare workers, because each of those groups come together from different lenses, it's far more powerful when it is allowed to evolve. And we've heard from Michael, it evolved, from Amanda, it evolved from, Lifehouse to now being across a number of wards. We heard that from Tim. And I think also, in what Joyce is saying in terms of where that starts and where that ends up, it's a very magical place to be. Amanda, quickly going, we might have just Amanda lost her, but Michael, what's your experience of where you started and where you finished? How different was that?
Yeah, I think that's a really interesting question, because when you're dealing with architects and builders, they wanted to know, what does it look like? Where are the action points? Where are we going to put the power?
I'm apologizing for that. Sorry.
No. But after a while, they kind of got it, which is quite amazing. So, all they wanted was the plans, what it was going to look like, how they had to engineer it into the site. And then once they kind of realized what the project could be, they really opened up. I remember the project manager, he was kind of like, yeah, let's just do this, and he didn't know what he was doing. Like, he didn't know what the physical outcome was going to be. And so using his energy, the general manager's energy, and the energy that Campbelltown Arts Centre brought with the artists and the community, you end up with a really, really different outcome. And if you start with the problem, we started with the problem, and you'll get something that's quite unique and quite localized. The incorporation of the language, the Dharawal language, the working with Ani Deidre in regards to what the native plants that could be incorporated into the building, the fabric of the building, so it didn't start with a preconceived idea. And once you kind of start going, what can we do? You get these amazing outcomes. And one of the benefits is there was only a very small budget, but because we were brought in so early, we were able to go integrate it into various parts of the building through the building process. And that was very cool. I remember, there was conversations about, what legacies do we want to leave? And, one thing was about space, creating space where things could happen beyond the build. And that was another fantastic outcome that we probably wouldn't have thought of in the first instance, but people wanted to continue making, rehearsing, doing things in the space, but there was no allocation for that space. So it was a great, just a really, co-design is the way forward. Yeah.
Is that your experience also, Amanda, that where you started looks very different from
Sorry,
where
I actually, sorry, Bridget, it's quite unstable. I dropped out before, so I didn't actually hear the question.
Oh, that's okay. We were talking about co-design and being open to, where you start and how it finishes can be often so far removed. Is your experience of being open to what artists can bring to health, have you found that it's very different as an outcome from where you started?
Yeah, I mean, look, anything, you don't want things to be too prescriptive, and we try to be as open with artists and residents and with our workshop programs. It's about giving people some starting points and then letting them go off in their own, basically their own direction. So I think they kind of feel good about that themselves. So I think, yeah.
And Tim, I'm sure that's the same for you at Gosford.
Look, absolutely. It's been that process of working through what, as we've worked with different sections of the hospital of what they want out of the experience as well, and them trusting us as an arts organisation to bring a cultural development lens to the outcomes that they're looking for as well. So it's sort of being able to design then a project that works for the clients that they want us to work with. And for them to trust us to actually say, well, it's not just about decorating something, it's actually about having a chance to have a conversation with those people about what they want to get out of it and bring that forward. That's where it works the best, I think, is, when there are no preconceived ideas of we just want something that's going to be decorative, or we just want something that's going to get people in and out and through a process and tick a box. It's really about actually stopping and listening to what everyone wants, and then trusting people to deliver, that they've got the capabilities to deliver that aspect of it as well. Yeah.
Joyce, we're in the middle of that with Barrel at the moment. We're not entirely sure where it will end up, but the energy of those shared experiences, I think bodes the project very well. Being in the middle of that process now, what's that like for you, and where do you see that ending up?
I think, like for this being my first, and as we talked before around, bringing some children in together, I feel when you're working with community, doesn't matter, and we're working with a lot of kids in our project as well. I think that uniform does not need to be regarded in the sense of kids and where they go to school. I think that, you know, like if we really thought about it, everyone should have been asked to wear a certain colour and everyone attend. It didn't matter what schools they came from. And I also thought that we, working in ours, we thought we had it correct in the way that we used our elders, but to get that message across as a health message, we've learnt that we could use our Aboriginal health workers working in the system to give that message, as well as people who are accepting the health that's provided at Bowral Hospital or any other hospital. You know, how do they see it? So for me, working at the hospitals for 10 years, Bowral and Bankstown, and we're connected all through Southwest Sydney with all our Aboriginal health workers and liaisons, we find that, you know, like, community is important, your health workers are important, and having that structure, bringing that into the health system and educating other people is really important, for the stories to be told, and for people to understand why Aboriginal people don't access our systems, and it actually is improving. So having artwork and community connected to that is very important, and I feel privileged to be a part of it, to be able to encourage all our communities. Bowral, you know, has been slower to bring Aboriginal people back to the hospitals and to use them, whereas I find Bankstown, working at Bankstown, is different, and the structure of Aboriginal people within their communities are different. So there's lots of learning. Even we as Aboriginal people learning all the things that we've learnt is great. And I feel privileged to be a part of that process for the last 10 years and seeing it grow.
Thanks, Annie Joyce. I've just got some questions from people online. And the first one here for you, Amanda, is how do you measure the clinical and other results of a program?
Say that again.
Wondering how you measure the clinical results of a program or any other sort of outcomes of your programs. How
So
do you measure them?
we do a lot of data. We see a lot of data as well. We see a lot of you know, patients who come to the ED who do not wait, who leave the ED, and there's lots of reasons why that happens in all hospitals for all people. You know, at the minute our hospitals are very, very busy places. So we try to, by interacting with me or any other Aboriginal person, so through the hospital, it helps our Aboriginal people to stay if they need to stay. But yeah, we do a lot of data. And we do a lot of education in small ways and big ways as well. And we connect from community to hospital, from hospital to community. We share clinical space and non-clinical space for Aboriginal people to be connected through frequent presenters programs, all that sort of stuff. But there's lots of data and lots of clinical stuff that's shown what works and what's not working, and we try to tackle what's not working to see how we can better. And a lot of that's got to do with, you know, like doing transforming your experience and things like that for patients to be able to say, you know, what they don't like about the hospital, what they experience.
Yeah, thank you. And also that same sort of question to Amanda, how do you sort of measure the clinical outcomes of your programs?
Yeah, so we do the similar thing. We have data sheets that we use on the iPads now, and we record every single intervention. So whether that's a conversation, whether that's art making, whether it's music, whether it's poetry, and also whether it's an inpatient, an outpatient, a staff member, or a visitor. So we collect all that. So we know how many engagements we have program as well.
Starting to lose Amanda's
So
connection.
it's, you know, it's great to have that.
Your connection's dropping out.
Sorry, it's I can't. Yeah. Sorry.
I'll go on to the last one
Yes.
here. Is can existing projects apply to the award or new projects only? And I guess we've been sort of quite intentional with this, that we sort of understand that projects, particularly sort of working with these collaborative methods of, you know, co-designing programs takes time. So yes, existing projects can apply, but I guess the panel would be sort of looking at, you know, what would the $10,000 do to try and amplify that project to sort of take it into a new direction. So
Or extend it to make it
extend it
more
to a-
sustainable.
yeah, to make it a sort of more sustainable, sort of longer term program. So so the Health and Art Award opens. Actually, another one here from Bridget. There's been a lot of discussion today about the positive impact of co-design. Is a co-design methodology a requirement for award submissions?
It is not, however, it substantively improves the sustainability of a program. So I think if you were not to co-design, you run the risk of the program not being viable beyond that which you've started. So we've heard from everyone today, for example, that where you start and where you finish is quite different. The purpose of the award is to try to set it up as much as possible to be able to continue into the future.
Yep, thank you. So details on the awards are all on our website, mgnsw.org.au. And I guess just to sort of clarify, we are a service organisation whose remit is to support museums, galleries and Aboriginal cultural centres. So that's the sort of parameters around which the award is so the applicants sort of need to be from those organisations in partnership with the local health district. And I guess closes on 9th of September, so there is time for these conversations to start. Some people might be sort of struggling with that sort of idea of how to form a partnership between sort of health and arts. So I guess to you, Bridget, to sort of talk to that about, you know, if someone's sort of floundering at how do they make that first step, what would you recommend to people?
Reach out to us and we'll be more than happy to support. There's obviously a huge workforce at New South Wales Health. Amanda, Joycey and I, we don't know everybody who works at New South Wales Health, but we'll be able to find someone who knows someone, I'm sure, to start that conversation.
Yeah, and there's the health infrastructure email that is part of the guidelines and the awards.
The frequently asked questions that are also listed on the website, I think is a good go-to for you to understand, well, what could be a local health district or specialty health network. Please don't be intimidated by that language. Each of them have various health services or hospitals that would be in your local area. And we would encourage, exactly as Michael, Tim and Joyce have done through their projects, Amanda, of course, as well, that generally speaking, your closest neighbouring hospital or healthcare service is generally speaking going to be quite interested in working with you.
Just, I guess another question to you is, can you think of any examples where there has been sort of museums working with, say, First Nations communities around in this sort of art and health sort of space?
Yeah, we've had huge support from museums across the state. Goulburn probably is a great example of the support that we've had there. We've had the Australian Museum support the Randwick Hospital, the Prince of Wales Hospital at Randwick. We had unearthed 8,000-year-old hearthstones as part of that project, and the Australian Museum did some forensic testing to assist us in dating that. So there's certainly an extraordinary capacity for museums to really support the cultural assets that are embodied in these services to tell the story of how we've cared for our communities for generations.
Great, thank you. We might wrap up there. Thanks for joining us all today. Thanks again to our speakers who've just given so much of their work and experience in working in this space. And I guess sort of for us as an organisation, we're sort of really excited about this partnership with health infrastructure, knowing that, you know, so many of the organisations that sort of work within our sort of area of museums and galleries and Aboriginal cultural spaces have that sort of idea of community wellbeing at their core. And we hope that this sort of partnership and this award just sort of really helps foster that in a sort of much more meaningful way. So thanks again for joining us.
Thank you.
Thank you.
Thank you.